Hello, everyone. It's Dr. Spencer. We're going to be talking about an important topic, and you might be thinking, why are we covering this in child and adolescent mental health course? Well, where do children begin? They begin with their mother and father. And so perinatal mental health is very important and an important topic that I thought we should cover. I do want to encourage you, if you're interested in this topic, would like to learn more, I'll have some additional resources at the end where you can, once you're a provider or even now, begin training to get additional education to provide care for perinatal mental health. And I would encourage you to do that. We're going to just look at some statistics first. So perinatal and maternal are kind of the same terms that are often used interchangeably. But perinatal mental health refers to the emotional well-being and mental health of individuals during the period surrounding pregnancy and postpartum period. This encompasses the time during pregnancy, childbirth, and the first year after giving birth. Perinatal mental health focuses on the psychological, emotional, and psychiatric challenges that individuals may experience during this critical phase of their lives. And here I've put up some terminology for you to see. One is the perinatal period. It's about 2-year time frame from conception to baby's first birthday. And then you have antenatal, prenatal, postpartum, or postnatal. Um, so just familiarize yourself with those terms. Over 50% of psychiatric patients are women. That means that over 80% of women will have at least one pregnancy, and 50% of these are unplanned. So you may see a patient who gets pregnant, a female patient who gets pregnant while you're caring for them. Maternal mental health conditions are the most common complications of pregnancy and childbirth, affecting 1 in 5 women, about 800,000 women each year in the United States. And maternal mental health conditions include depression, anxiety disorders, obsessive compulsive disorders, post-traumatic disorder, stress disorder, bipolar illness, which may include psychotic symptoms, very dangerous, as we'll talk about, and substance use disorders. Suicide and overdose are the leading cause of death in the first year postpartum, with 100% of these deaths deemed preventable. So that's important to know. 75% of women experience maternal mental health conditions do not get the care they need. And the cost of not treating maternal mental health conditions is about $32,000 per mother-infant pair, totaling about $14.2 billion nationally. And then all parents, including fathers, partners, adoptive parents, can experience changes in mood when there is a new baby in the household. So what are some perinatal mental health conditions? Well, depression is one of them, anxiety, obsessive compulsive disorder, post-traumatic stress disorder, bipolar disorder, postpartum psychosis, and substance use disorder. Now, substance use disorder will be covered under another lecture in another week for the perinatal mental health. So we won't be diving into that one here. I'm going to provide you with guidelines and resources that you want to be very familiar with. The American College of Obstetricians and Gynecologists has put out a brand new treatment and management evidence-based practice guideline that I got access to and I provided for you. It just came out in June of 2023. I also want to talk about some of the consequences of untreated maternal mental health conditions. This is a really nice fact sheet that you'll be able to access on your own. That's from the Maternal Mental Health Leadership Alliance. But as you can see here, Some of the consequences of untreated maternal mental health conditions in the mother are they don't know how to manage their own health, have poor nutrition, use substances such as alcohol, drugs, experience physical, emotional, sexual abuse, less responsive to baby, have fewer positive interactions with baby, experience breastfeeding challenges, question their competence as mothers. And parents who are depressed or anxious are more likely to make more trips to the emergency department, find it particularly challenging to manage their child's chronic health conditions, and not follow guidance for safety, infant sleep, and car seat usage. Well, then what are the effects to baby? Well, they can be low term birth weight or small head size, premature, longer stays in the NICU, excessive crying, impaired parent child interactions, behavioral, cognitive, or emotional delays. Um, just some important things for you to think about. So here we're looking at a summary of some perinatal mental health conditions. I'm not going to go through all of these one by one because that would just be really time consuming for us to do that. But you can see here there's baby blues, what that is defined as. And I'm going to provide you guys with this awesome document from Lifeline from Moms for Moms. It's amazing. I found it as I was preparing for this class, and I'm going to share it with you. It has treatment guidelines, the whole algorithms. It's really a great resource, which I hope will be helpful for you. Anyway, you can look at here unipolar major depression, and it talks about what it is, what it does. And it's important to note that the DSM 5 defines perinatal depression as a major depressive disorder with a time onset specifier. Okay. So just remember that perinatal depression is under your major depressive disorder, but it's not listed as perinatal depression. Okay. The same with bipolar disorder. All right. And you can see all of these here when it happens, how it occurs, how long it lasts. Um, and they define, by the way, most experts would believe for post perinatal depression that it's the last up to 12 months postpartum. Um, so some have said 4 weeks postpartum, but I think most experts agree that up to 12 months postpartum would be the case. Then we have perinatal anxiety disorders, schizoaffective, schizophrenia, and postpartum psychosis, which is dangerous. And patients need to be sent immediately to the hospital as necessary, requires immediate psychiatric help, as you can see here. Hospitalization usually necessary. It's very rare, fortunately, but it can happen. Then you have your borderline personality, post-traumatic disorder, um, and then obsessive compulsive disorders. And I would just like to say, I have recently had two different patients. One who had obsessive compulsive disorder. She was pregnant, and just obsessing about everything related to what's going on with the baby, intrusive thoughts, things that didn't make sense to her. So fortunately, she was in counseling. Um, and after much discussion, we did decide on a medication. And of course, I discussed risks and benefits of all that to her. And she has been doing well. And then I had just a few weeks ago, at the time of this recording, I had a patient that I've been seeing for a while. She's 28, showed up to my office, and I hadn't seen her in a while, and she's 4 months pregnant, experiencing a lot of anxiety. She had previously had a miscarriage and was very anxious about this child and that everything would be okay. Again, she's in counseling, and she had been on Zoloft with me, but at a low dose. So we did increase her Zoloft, and I will be following up with her in a few weeks to see if she's improving. So you will see these cases. Mm. Screening tests, very important for you to know about. You will likely see these on a test question or on boards. The Edinburgh Postnatal Depression Scale is kind of the gold standard for perinatal care, screening for depression. You have your PHQ-9, your bipolar disorder questionnaire, your GAD-7, and the post-traumatic stress disorder questionnaire. Um, so be familiar with these. You definitely want to know the scores. I like this one that I have here. It tells you kind of the interpretation and then the score, and then what to do with that. So I found this one um, for free use on the internet. And then assessing for perinatal mental health, as I shared with you, this is the document that I'm going to be giving you guys. And let me switch screens and I'll show you what that looks like. It's an excellent, excellent resource. Okay, this is the Lifeline for Moms Perinatal Mental Health Toolkit. I love this resource. This is the most recent version, I believe. Copyright is 2019. They have an older one, so just make sure you get the new one. And I'm going to be providing you the links for this. I'm just going to go through this. This is all the stuff in here. And I'm moving kind of fast. I apologize. But so they talk about screening for mood, and then they provide you with the screening tests, okay, which is really nice. And then screening for mood changes during pregnancy. And then they provide you, with that, with the screening tools. Here's your depression, your Edinburgh screening test. That's so nice. And how to score these things. And then they have this nice flow sheet, assessing perinatal mental health. What do you do here? Well, if they're depressed, PHQ greater than 9, um, do they have self-harm? And it just really walks you through all of that, determine their severity of illness, if it's severe, moderate to mild, and what to do. And then they talk about starting treatment for perinatal mental health conditions. Um, always, always, always psychotherapy, counseling, and then medication is always an option as well. Um, being mindful to talk about risks and benefits of medication, because medication can work and be helpful, but parents need to be informed and make good choices, which sometimes being on medication is better than not, because the risk of suicide or death outweighs um, not having a medication. So they talk about medication treatment, all of this. Again, such a nice outline. They give you medication dosage and recommendations, um, and follow-up treatment, all of this. Again, I encourage you, if this is a passion or something you're interested in or are seeing a lot of these types of patients, to really get some additional training, which is a lot of it is free. Some of it you do have to pay for. But I think it'd be very helpful to you. And as I showed you guys earlier, this talking about starting treatment for perinatal mental health conditions. Um, you can use that. Now, I've included this lecture for you. This amazing lecture that I listened to, actually by happenstance before I even put this course together, or this lecture together, on pregnancy planning for patients taking psychiatric medications or with a mental health history. I want you to listen to this podcast, listen to it while you're walking, listen to it while you're driving to clinical, listen to it while you're have all this downtime. Just kidding. I know you don't have any downtime, but you do need to listen to this. And I've also included the lecture notes. Um, This lecture was just mind blowing to me and really changed my perspective and thoughts on caring for the perinatal patient, and especially with medication. So I really, really want you um, to listen to this. I did reach out to Dr. Pruder, who puts these podcasts together, and he gave me permission to share this and to share the notes from the lecture as well. Um, so antidepressants, some of your medications, antidepressants are considered to carry risk of neonatal adaptation syndrome, which is self-limiting and it's not harmful to the baby. You'll hear more about this in the lecture. Tricyclic antidepressants, dysparamiine and nortriptyline, are preferred during pregnancy due to lower anticholinergic effects and might reduce the risk of orthostatic hypotension. Um, Monoamine oxidase inhibitors should be avoided in pregnancy. Okay, just be aware of that. You don't want any pregnant patient to get those. Um, mood stabilizers, something you need to know, and we'll likely see this on boards. Lithium is associated with heart defects and specifically like Epstein's anomaly. That does not mean we don't or can't use lithium in pregnancy, but it has to be monitored closely. Remember, if a patient is bipolar, better to have them treated and have their mania and other symptoms treated than not treated, which puts them at greater risk, and baby as well. But it does require monitoring. So just be mindful of the associated with certain heart defects, particularly Epstein's anomaly. This one is very important that you should all know. Anti-epileptic drugs, which we use typically for people with bipolar disorder. You want to avoid valproic acid, valproate, dalvalproic, or Depakote in women of childbearing years. I can't stress that enough, unless I have used this in women who um, may have some type of more secure form of birth control. Say they have an IUD, which is not 100%, but they have an Nexplanon, um, uh, versus just maybe taking oral contraceptive, because that's not always as effective. And we know none of these are 100% effective, but I do have a discussion with them. If they get pregnant, there are these risks and it can cause neural tube defects. And so if they do get pregnant, of course, you'd want to put them on folic acid. Can particularly cause spina bifida. So these drugs are definitely a no-no during pregnancy. Um, and again, be very careful using these in women of childbearing age. Not to say that that can't be used, but just having that conversation with women and letting them know that, hey, the risk of pregnancy could cause some defects to your child. If you want to get pregnant, let's talk about that, because we could switch to a better medication before getting pregnant. And then again, same with carbamazepine, Tegretol should be avoided in pregnancy, increased risk of congenital malformations, including neural tube defects, craniofacial abnormalities, skeletal disorders, hypospadias, diaphragmatic hernia, risk of hemorrhage in the newborn. So again, be aware of these. You will likely see this somewhere else, and it's just best care, best practice for your female patients. Okay. And I provided you with some amazing resources here that you can look up if you click on the links. This Postpartum Support International. I'm going to actually go to the web page. So let me stop the share, and I'm going to share a new. Let me find the web pages for you. Okay, good. So Postpartum International. Great, excellent resource for you. I would bookmark this. I would use this. You can get trainings here. So if you go under for professionals, you click trainings. You'll find that you can get some training in how to care for the perinatal mental health care. I love this site, the Maternal Mental Health Leadership Health Alliance. Great website as well, and they have lots of statistics and fact sheets that you can that you can give, which is what I was just kind of showing you. I love these. You can download these, share these with your patients, share these at your practice. Um, there's all kinds of fact sheets here that you can share. Let me go back. Um, so they have a maternal mental health overview, advocating, which is for maternal mental health, which is something all of us should be doing, male and female. Black women, birthing people, and maternal mental health. And I think I wanted to share this. Almost 40% of Black mothers um, experience maternal mental health conditions compared to white women. So higher rates of um, issues with our Black patients when it comes to pregnancy. So be aware of that as well. And then you can just find these fascinating fact sheets that you can share. Um, another great website here, the Massachusetts General Hospital Center for Reproductive Health. Amazing stuff that you can share and go through. This is another training place, the National Curriculum in Reproductive Psychiatry. You do have to pay for this, but it's a great source for you. I really like this site too. 2020 Moms. It's a policy center advocacy. Maybe you want to get involved with something like that. Take a look at that. ACOG, American College of Obstetricians and Gynecologists. They have a perinatal mental health toolkit for you with patient screenings, different free resources that you can use. So you don't have to pay for stuff. Okay. Remember, screening is not diagnostic, it's just a screening. But so you want to, if they're positive for something, you'd have to also make a diagnosis. And this is that lifeline for moms that I was talking to you about. I just love this site. It has the that document that I was sharing with you. Where is that though? Yeah, under resources, materials for providers, and you can come down to the perinatal mental health products, toolkits, and apps, and you can find their stuff here. There's an app that you can get, and there's also the guidelines that I was sharing with you that you could get. And you want to make sure that you are clicking on the right one. Here's where you would go for that. This is the 2019. Oh, here's a 2022 version. So this is 2019. So make sure you get the correct version for yourself. And then here is the Selene Institute, where you can do, again, maternal health professional trainings. So I hope you find this helpful. Um, and that's our references for today. I will be making these slides available as a PDF for you. Again, really consider additional training for maternal mental health and looking at these conditions and how to best care for this population. And thank you.